If someone presents to us with chest pain, we have to think of what is happening to him. So by saying chest pain, of course, we have to know what the hell is inside the chest. Now, this is a chest. Let's move it slightly to the center. In the chest, we have lungs and heart and a lot of other things, but for the moment, let's just focus on the heart first. So, if the chest pain origin is from the heart, what can we think about? First of all, the most common heart problem that anyone can be facing? Try guessing. Yeah, you got it right. It's heart attack. So this heart attack is actually also known as coronary syndrome. A very high-fi word, right? What the hell does that mean? Acute means it happens very fast. Coronary means relating to the heart. Syndrome just means syndrome. So it's something affecting the heart in a very short amount of time, right? Therefore, it's called as a heart attack. It happens very fast. Another problem that can happen to our heart is infection of the heart. Infection. And by this, it can be myocarditis, endocarditis, or pericarditis. You know, we have three layers protecting the heart, right? Three layers of heart covering. Another problem that can also happen to the heart is aortic dissection. What does that mean? Dissect. Dissect means we cut. We often say dissect when we want to cut up a dead body, right? So this is a body. We use a knife to cut something out, and then we zoom into it and see whatever thing is in it, right? We call this dissect. Dissect. This we cut something out. So aortic dissection, it means we cut the aorta, right? This one is the aorta, the largest artery in the body, leaving the heart. So when the artery is cut, of course, we will feel very intense tearing pain happening. Another thing that could have happened is called an angina. In this case, our angina is a stable type. There's also an unstable type, which I will talk about later, which is somewhere included in this part. But the stable angina is a different one. So we'll put it here as number 4, stable angina. And there's another one that is also very, very common. It's called as the pulmonary embolism. What is it? Pulmonary means the lungs, affecting the lungs. But why am I writing it under heart? Because lung is closely associated with heart. Lungs is closely associated with heart. So if you can take a look at this picture shows the blood, artery, and vein supplies of the heart and the lungs. In the case of a pulmonary embolism, the pulmonary artery, arteria, not the vein, okay? Not the vein. it's the artery. Also, this left and right pulmonary artery are blocked by an embolism. We call this an, sorry, not embolism, embolus. The thing that travels through the blood flow from other part of the body is called an embolus. That embolus can be a blood clot or it can be a foreign body. And when it's stuck in the pulmonary artery, it is still an embolus. But the process of this embolus to travel and get stuck, this whole process, we call it embolism. So when the pulmonary embolism happens, the blood cannot leave the heart and then reach the lung because usually this is the vena cava and then blood enters the right atrium, right ventricle, and then it pumps up to the pulmonary artery and then it's uh, divided into left and right. But if the pulmonary artery anywhere of it, either here or either here or either here, anywhere of it's blocked, then blood is blocked at the site. Therefore, when the blood cannot flow through, it goes back and it increases the pressure here. Blood accumulates at the right atrium and ventricle, and the blood pressure at this area increases. When the blood pressure increases and more blood accumulated here, the heart needs to pump faster and harder in order to pump all the blood outside. But if the heart muscle exceeds its limit of pumping, then the muscle will be damaged. The heart muscle will be damaged, which leads the heart muscle unable to pump again. Therefore, we call this situation as the right heart failure. Right heart failure. Alright? So this pulmonary embolism can cause right-sided heart failure. Right? But take note, there is another name. If the right-sided heart failure is caused by something in the lungs, this right-sided heart failure can also be known as cor pulmonale. Cor pulmonale. It is one type of right-sided heart failure. Alright, now we got all our heart causes of chest pain. Now let's zoom in into the lung causes of chest pain. Well, we're out of space here, so we'll focus here. Lungs. We have two lungs, right? The right lung and the left lung. So this one is the right, this one is the left. So in terms of lung problem, what problem can it be? Can you think of any? Nah, don't tell me pulmonary embolism. I already say it's the heart problem. Huh? Pneumothorax? Yeah, smart. So the one thing that can cause lung chest pain is thorax. This is a very difficult word, right? Well, it is for me, so I'm gonna explain what it means. Pneumo means there is the presence of air. Whenever there air in something, we call it pneumo. So if there's pneumothorax, there's air in the thorax. Easy, right? But how come how come air in the thorax can cause pain? So how does this pneumothorax cause pain? For that, we have to zoom inside this picture. Okay, to zoom inside this picture. We have to look at the lungs more clearly. We can look at this picture. Let's revise some of the lungs anatomy. This is our lung. Our lung is surrounded by pleura. What is a pleura? So it says right here, pleura basically means a layer, like a membrane that lines the lung. So there are two layers of pleura, right? See here, one layer is here and another one outside here. So in between two layers of pleura, there's an empty space. We call this space pleural space. Okay, the space is pleural space. So when there is a pneumothorax, air, it means the air from inside the lung leaks out into the pleural space. So how can this happen? In order for the air inside the lung to leak out into the pleural space, it has to be some damage to the lungs, right? So it can either be trauma, just basically just means injury. It's just a fancy word. Let's just say it's injury, okay? Or it can be increased pressure, which can be due to a disease called as asthma. I will talk about this maybe later in other videos, but asthma and COPD, it causes air to trap inside the lungs, trap air, lungs. Therefore, the pressure in the lungs is so increased until the lung is punctured and air comes out. So if there are a lot of air in the pleural space, the air will exert extra pressure on the lung itself, will exert extra pressure on the lungs, causing the lungs to become smaller. In this case, we call it lung collapse. That's it. The next problem that could have happened to our lung causing pain is, try to guess. It is something that is somewhat related, or not directly, but the concept is somewhat here. The tip is somewhat here. Can you think of any? Something that happened to our heart now happened to our lungs as well. 3 seconds. 3, 2, 1. No? Okay. It's infection. Nah. You gotta say, nah, I knew it. Well, if you did, congratulations. But the answer is infection. But the infection for lung, now we call it as pneumonia. Don't ask me why it doesn't end with itis, like myocarditis, ditis, or itis. Don't tell me why it's not pneumonitis. I have no idea. But the pneumo here, does it involve air? No. Does it involve air? No. So what does this pneumo means? I said pneumo means air just now, didn't I? But in this case, pneumo just means lungs. And this pnea basically brings no meaning. It's an ancient Greek word that just translates to inflammation of the lungs. Well, if it is me who's going to give this name, I'm going to say it's pulmonary-nitis, because pulmonary means lungs, itis means inflammation. So why don't just make it pulmonary-nitis? I'm not a scientist, so I guess we just have to follow pneumonia. Tough life. But take note that pneumonia doesn't always cause pain. Let's look at this picture here. So, how does the infection of lung occur? We have to know that first. Where is the head? Let's draw one. Okay. Pneumonia always enters from our nose and then travels down the trachea, the bronchus, and then reaches our alveoli, like this. But then there are no pain receptors anywhere along our lower respiratory tract, anywhere along the trachea, bronchus. There are no pain receptors. So if there are no pain receptors, if inflammation happens around anywhere in these areas, will we feel pain? We feel pain? The answer is yes. No. The answer is no. So how will pneumonia cause pain? There's only one condition that makes pneumonia cause pain, which is when there is parapneumonic effusion, which means the bacteria has traveled from the alveoli and it has spreaded through to the pleural space. And when the bacteria are in the pleural space, the exudate will form. So there will be exudate, which is just the basically the pus, the whitish, a bit sticky, whitish yellow sticky liquid pus, which consists of mainly white blood cells and all the inflammatory cytokines and stuff that will fill this area. It will fill the pleural space. And that fluid and this fluid we now call it as effusion. We now call it effusion. And since it is para, it means beyond, like you go beyond something, you go over something. This one is beyond lung inflammation. So it goes beyond the lung inflammation into the pleural space. That's why we call it parapneumonic diffusion. And this diffusion, it stimulates the pain receptors on the parietal pleura, as I've said just now. Then you will have chest pain. Another problem that can be to lungs is, but I'm not going to go into one because it's less common than those infection and pneumothorax. But just know there's something like air in the mediastinum. Mediastinum is basically the space in between two lungs, which consists of the heart and other structures. So that is for the lung. There are also other causes of chest pain because the thorax also consists of the esophagus. So with esophagus, we can have gastroesophageal reflux GERD, which is the content in the stomach backflow into the esophagus. So this GERD can actually lead to esophagitis. Another common thing that we can have is actually the problem related to cartilage. It is known as costochondritis. So, costochondritis. If you look at this picture, you can see this is the ribs, and the red one right here is the cartilage. So, costo is actually a prefix ribs. This chondr is actually chondr is actually cartilage. Itis means inflammation. So it's rib cartilage inflammation. So it's an inflammation of this thing right here. This is called as the rib cartilage or the costal cartilage. Costal cartilage. But you have to know that the cartilage itself does not have a pain receptors. This cartilage has no pain receptor. But when they are inflamed, they will affect the bones around them. See, they will affect the bones around them. So it's actually the bone that feels the pain. The bone feels the pain. So we'll have this costochondritis. Last but not least, chest pain can also caused by anxiety. So if you have severe anxiety before an exam or something, you may have chest pain. But I'm not going to go into details for this anxiety because it's more towards psychological problem, which will be something for another posting. So these are the few things that can cause chest pain. So remember them. I hope this video helps you and I'll see you in the next video. Bye.